115 Americans die every day from an opioid overdose. That's according to the CDC. And Utah ranks 7th in the nation for overdose deaths.
Now, the Utah Health Department says that overdosing now outpaces deaths from firearms, from falls, and car crashes. Tonight, News 4 Utah's Saray Chin tells us about ways people and healthcare providers are kicking the dependency on opioids.
There is no silver bullet when it comes to solving the opidemic, but healthcare systems in the state are aggressively attacking the problem. Intermountain Healthcare is reducing opioid prescriptions. That mere thought could put patients who are living with chronic pain in a panic.
I felt like I needed more pain medication, not less.
Mark Love of Riverton suffers a genetic pain nerve disorder.
It continued to be excruciating pain.
13 years ago, Mark was so desperate, he took extreme measures to rid the pain.
Got some dry ice, and I used it to numb my feet.
He became a double amputee.
When I came out of the hospital, I was on a lot of narcotics.
Those addictive drugs stuck around for 10 years. The meds robbing him of his life.
The goal started because the community is asking for it.
Dr. David Hazelton, Senior Medical Director at Intermountain Healthcare, says they are halfway to their goal of a 40% reduction in prescribing opioids for acute care, meaning for people like Mark after surgeries or injuries.
We have far too many deaths in the community. We have far too many people receiving opiates who don't need them. We have far too many people who have more opiates after procedures than they need.
Intermountain had been slowly helping patients pull back on the pills years before. Mark's doctor 3 years ago recommended he go to a pain clinic class to reduce his dependency on opioids.
What do you tell your doctor? Because you don't want them to think that you're an addict or that you're only there to get more pain medication. What other choice do I have?
And what he noticed in class put him on a path to changing his life.
They were out of it, that, sleeping at the table and half there, and kind of opened my eyes to see that, I'm not living my life either.
Intermountain Healthcare is not the only one reducing opioid prescriptions. Mountain Star Health System is cutting pills by half in the emergency room. But it will take more, a culture shift for both physicians and patients. Dr. Hazelton says alternative therapy can be effective for relieving pain, such as whirlpool, massage therapy, meditation, and acupuncture.
I've been coming here for about 2 years.
John Gale has been coming to licensed acupuncturist Master Tai Hao Lu on State Street in Salt Lake for arthritis and severe inflammation.
As a person who was deathly afraid of needles, I don't even flinch anymore.
So we look at channels, and channels are like vessels throughout the body, help improve that blood circulation to allow his body to self-heal.
Master Lu believes this ancient Chinese practice is an important part of reducing the opioid epidemic. Even the FDA and Joint Commission recommend it as a first line of treatment. Acupuncture can help reduce cravings, addiction, pain relief, and mental health issues.
Anybody with an opioid problem will first help with the pain so they can cut down the opioid, and then as well as help with the addiction part.
I haven't used a lower tab now for, I want to say, close to 8 or 9 years.
Part of Mark's pain management wasn't acupuncture, but another ancient art form,